Alright, let's talk about FGR. Definition FGR, less than 10 percentile for gestational age, or abdominal circumference less than 10 percentile. SGA is a newborn weight less than 10 percentile. Neonatal complications, hypoglycemia, hyperbilirubinemia, hypothermia, intraventricular hemorrhage, necrotizing enterocolitis, seizures, sepsis, respiratory distress syndrome. Etiology can be divided into maternal, fetal, and placental. So maternal diseases, hypertensive disease, AMA, APS, SLE, hereditary thrombophilias are not associated with FGR, such as factor V, prothrombin mutations, and MTFHR. Other maternal causes, smoking, alcohol, cocaine, narcotics use. If the patient has poor nutrition intake, less than 600 to 900 kilocalories prior to 36 weeks is associated with SGA. Fetal causes multiple gestation, 25% risk of SGA. Monochorionic has higher risk due to placental sharing, teratogen exposure, anti-neoplastic and anti-epileptic, cyclophosphamide, valproate, warfarin, infectious diseases, malaria worldwide is a cause, CMV, rubella, toxo, varicella, syphilis, genetic and structural diseases. 50% of trisomy 13 and 18 have FGR. Congenital heart diseases, gastroschisis, and then placental or umbilical cord diseases, abruption, infarction, circumvallate shape, hemangiomas, chorioangiomas, Valentis cord or marginal cord insertion, and then about 1% of pregnancy is complicated by a single umbilical artery, which is also associated with cardiac abnormalities. Increased risk for stillbirth for FGR patient babies, 1.5% at 10 percentile and 2.5% at 5th percentile. Evaluation, umbilical Doppler and fluid assessment, fundal height measurement starting after 24 weeks. If there's a discrepancy greater than 3, there should be a further evaluation. Risk of reoccurrence is about 20%. Prior history of SGA and current normal weight is not indication for NST, BPP, or umbilical Dopplers. 32 weeks FGR or IUGR and structural defects should prompt genetic testing. Serial ultrasound should not be done less than 2 weeks. Delivery, if it's isolated, IUGR usually around 38 weeks. If it's FGR with additional risk factors such as oligo, abnormal umbilical Doppler, or maternal risk factors, should be 34 weeks. Give steroids 7 days prior to anticipated delivery. 3 to 10 percentile, but normal umbilical Doppler should be 38 to 39 weeks. Isolated FGR less than 3 percentile should be 37 weeks. So less than 3 percentile, 37, 3 to 10 is 38. If there's abnormal Dopplers, 34.